In 1960, my mother and I moved from Japan to Canada. In a small prairie town in southern Alberta, there was no special ESL class, and no one spoke Japanese, so I had to learn English to survive. Soon, I was immersed in the English-speaking world, but my mother struggled with her English all her life. When I was 13, I was in a major car accident, which required 10 months hospital stay with many surgeries and daily physiotherapy. One of my surgeries left my left arm permanently paralyzed. My mother, with her poor English, never quite understood what was happening or what the doctor said to her throughout my recovery, and blamed herself for the paralysis and scars that became part of me. For me, the bigger damage was not scars on my arm, but internal scars that impacted my sense of self growing up. In Japanese culture, a cripple like me was destined to remain single, leading an obscure life, so my relatives were surprised that I was married at age 24. They were ever more surprised when I had a successful career with the federal government, a home support agency, and manager for an assisted living home. In addition to all this, I was a mother of 2 children. In spite of leading a normal life, my sense of self remained fragile until one day I heard Dr. Dobson, a psychologist, speaking about self-worth. He said his self-worth was not based on his education, occupation, net worth, but it was based on knowing that Jesus, Son of God, loved him enough to pay for all the wrongs committed by mankind. This made me realize that I was loved as I was. This truth released me from the hard shell I had built around myself, and my focus shifted from my trials to helping others. I started volunteering as a visitor for the geriatric floor at the Chinook Hospital in Lethbridge, co-led a Better Choice, Better Health workshop, and eventually became a patient family advisor. Those roles provided me with an opportunity to be a voice for people who could not articulate their thoughts and wishes to the medical staff because of language or cultural difference. At the end of her life, I became my mother's translator in the healthcare system, like she had tried to be for me these years long ago. Things had changed. At times, it was not necessary for me to translate, as her geriatrician was fluent in Japanese. It was heartwarming to hear him attempting to speak to my mother in her language. Shortly before her passing, she made a remark. The last 10 years had been the happiest time in my life. In her honor, my desire is to continue to be a voice for those who cannot speak for themselves.